Good morning, students. So we are going to study ovarian neoplasms. WHO classification of ovarian neoplasms. We have discussed surface epithelial tumors, which include serous tumors, mucinous tumors, endometrioid, clear cell tumors, transitional cell tumors, and epithelial stromal tumors. Second category was sex cord-stromal tumors, which include granulosa cell tumors, fibromas, fibrothecomas, thecomas, Sertoli cell tumors, Leydig cell tumors, sex cord tumors with annular tubules, gynandroblastoma, and steroid cell tumors. Third category and important tumors are germ cell tumors, which include teratoma, which is further divided as immature teratoma or malignant teratoma, mature teratoma, which is benign. It could be cystic or solid. Cystic mature teratoma is also known as dermoid cyst and monodermal teratoma. After teratoma, dysgerminoma, then yolk sac tumor, embryonal carcinoma, choriocarcinoma, and mixed germ cell tumors. Then malignant not otherwise specified tumors and metastatic tumors. Metastasis could be from colon, stomach, or breast. So the classification of ovarian tumor is very important. You have to remember number one tumors, surface epithelial tumors, which include serous tumors, which could be benign, borderline, malignant, serous cyst adenoma, serous borderline, serous cyst adenocarcinoma. Then mucinous tumors, endometrioid tumors, clear cell tumors, transitional cell tumors, and epithelial stromal tumors. Then sex cord-stromal tumors include granulosa cell tumors. This is important tumor. Then fibroma, fibrothecoma or thecoma, Leydig cell tumor, Sertoli cell tumor. Germ cell tumors include teratoma, dysgerminoma. Dysgerminoma is the counterpart of testicular tumor, seminoma. Yolk sac tumor, embryonal carcinoma, choriocarcinoma, mixed germ cell tumor. Malignant not otherwise specified tumors and metastatic. So this is ovary. This is the surface epithelium of the ovary. So tumor arising from surface epithelial cells are surface epithelial stromal cell tumors. These include serous tumors, mucinous tumors, endometrioid tumor, clear cell, Brenners, cystadeno-fibromas. Germ cells, tumor arising from germ cells are teratoma, dysgerminoma, endodermal sinus, and choriocarcinoma. Sex cord-stromal tumors, fibroma, granulosa cell tumors, and metastatic to ovary. So, overall frequency means most common tumors are surface epithelial tumors, comprising 65 to 70%. and proportion of malignant ovarian tumors 90%. So most common tumors are surface epithelial tumors, and malignant forms most common are surface epithelial tumors. Age group affected is 20 plus years. After 20 years of age, the female may have surface epithelial tumors. Then germ cell tumors is second in frequency, then surface epithelial tumors, after that sex cord tumor, stromal tumors, and then metastatic. Malignant transformation is very low, 3 to 5% in germ cells and 2 to 3% in sex cord. The proportion of malignant ovarian tumors 3 to 5%. Sex cord stromal tumor is seen in all age group, and germ cell tumors in 0 to 25 years. So reproductive age group is most common age group involving these ovarian tumors. So coming to serous tumors. Serous tumors are surface epithelial tumors. Together, benign, borderline and malignant types, they account for about 30% of all ovarian tumors and just over 50% of the ovarian epithelial tumors. 70% are benign or borderline and 30% are malignant. So, overall ovarian tumors, in overall ovarian tumors, the serous tumors comprise 30% of the tumors, and mostly they are benign. 70% are benign and 30% are malignant. Serous carcinoma account for approximately 40% of all cancers of the ovary and are most common malignant ovarian neoplasms. So, carcinoma, malignant form is also, commonest malignant form is also of serous type, serous carcinoma. Benign and borderline tumors are common between ages of 20 and 45 years. So, serous tumors are most common among the ovarian tumors, and 50% of ovarian epithelial tumors, they are mostly benign. Benign are also common benign tumors are also serous tumors, and carcinomas are also serous carcinoma. Characteristic serous tumor may present on gross examination as either a cystic lesion in which the papillary epithelium is contained within a few fibrous walled cysts or projecting from the surface epithelium. Borderline tumors contain an increased number of papillary projections. Bilaterality is common, occurring in 20% of benign serous cystadenomas, 30% of serous borderline tumors, and approximately 66% of serous carcinomas. So, serous tumors are mostly cystic tumors. Ovary is cystically enlarged. On cutting open, then we will cut the tumor, then serous fluid will come out. You can see a single loculated cyst or maybe multiple, but single cyst is common, filled with serous material or serous fluid. There may be papillary projections within the wall, and tumors are bilateral. You can see the enlarged ovary with cyst, and these are solid area with papillary projections. On histologic examination, the cysts are lined by, these are the cysts, lined by the columnar epithelium with abundant cilia in benign tumors. Cysts lined by columnar epithelium. Then mucinous tumors. Mucinous tumors are less common than serous tumors, accounting for approximately 30% of all ovarian neoplasms. So most common are serous, then mucinous tumors. They principally occur in middle adult life and are rare before puberty and after menopause. 80% are benign and 15% are malignant. So benign tumors are common. Mucinous tumors are less common than serous tumors and 80% are benign. Now this is the gross picture of mucinous tumor. You can see ovary is enlarged with cystic spaces, multiple locules. It is multiloculated, multiple cyst formation filled with mucoid material. Whereas the serous tumors, they have unicystic swelling. Unicystic, single cyst is most common in this. While in mucinous tumors, multiple cysts. It is multiloculated tumors and it is filled with sticky gelatinous fluid rich in glycoprotein. So material is mucinous or sticky gelatinous fluid, while in case of serous tumors, there is fluid, serous fluid. This is the microscopy of mucinous tumor. They are lined by tall columnar epithelial cells, while in serous, low columnar with cilia. In this, tall columnar with apical mucin and absence of cilia. Columnar cells with mucin and there is no cilia, while in serous, low columnar with cilia. Now, teratomas. In teratomas, mature or benign teratomas are most common, and most benign teratomas are cystic. So, there is cyst formation in teratomas also. So, it is also known as dermoid cyst. Cystic teratomas are usually found in young women during the active reproductive years. So, it is a benign tumor. Mature teratoma is benign tumor, also known as dermoid cyst, because there is cyst formation and it is seen in young women. So this is the gross picture of dermoid cyst. It is bilateral in 10 to 15% of the cases, and you can see unilocular cysts containing hair. These are hair and cheesy sebaceous material. On cut section, they reveal a thin wall lined by an opaque gray-white wrinkled epidermis. From the epidermis, hair shaft frequently protrude. You can also find tooth structures and areas of calcification. So basically, structures arising from all the three germ layers are seen, like hair, tooth. You can find skin, cartilage, like fat, etc.